I'm a colorectal surgeon, consultant surgeon, Mr Gandra Harinath. I've been in William Harvey for over 12 years as a consultant colorectal surgeon, and I practice at One Ashford as well. I'm interested in not only colorectal surgery, I'm interested in other specialties as well, but my main practice is laparoscopic bowel cancer resections. In terms of symptoms of the bowel cancers, typically patients will have either rectal bleeding or change in bowel habits. Depending on the position of the tumor, you could have other symptoms as well, but patients sometimes have other symptoms such as loss of weight and loss of appetite. Usually these are late symptoms. Sometimes you may not have any symptoms at all, and when you have a routine screening, sometimes we pick up bowel cancers. Of course, that is also possible, but typically patients will have bleeding through the bottom end, and they will have a change in the bowels. These are the two typical symptoms, but there are some atypical symptoms. As I said, there may be loss of weight, loss of appetite, and patients may have a family history of bowel cancer and so on. Well, the usual diagnosis is through a thorough history taking, examination first by an experienced clinician, and this usually ends up either a diagnosis straight away due to a presence of a mass in the tummy or due to a presence of a mass in the bottom end, or often an investigation such as a colonoscopy is required. So we send patients for an endoscopic examination of the bowel, and this will detect any pathology in the large bowel, not only cancers, other conditions which will cause similar symptoms can be found out. And depending on the position of the tumor, you may also need other investigations such as CT scan, MRI scan, and so on. We also do a blood test called a CEA, which is not a diagnostic test on its own. However, this is typically done once a diagnosis of a cancer is confirmed on the other investigations such as colonoscopy. Okay, bowel cancers are very much treatable. There are various treatment options available. The first and foremost is surgery. This is curative. There are other treatment options such as radiotherapy and chemotherapy, and this is typically for people who got advanced disease or who have got a disease which is incurable, which means it's a palliative treatment. If somebody has got a colon cancer, typically if it is localized, then we would tend to offer an operation which could be a resection of the bowel, and typically that is done with a keyhole, small holes, and if somebody has got advanced disease, obviously we have to think about making the tumor much smaller by giving radiotherapy or chemotherapy first, and then think about surgical options. Okay, we can see them very quickly at One Ashford Hospital. We've got investigations such as colonoscopy, CT scan, MRI scan, which can be arranged very quickly. We've got dedicated teams carrying out these investigations. We can come to a diagnosis very quickly and we can reassure them. And a lot of people we've investigated at One Ashford Hospital are thoroughly satisfied and they're happy.